Welcome to NSG 229, Study Session 15, Tetanus. Introduction. You will learn about another type of disease of the under 5. This is called tetanus. Most people have, at one time or the other, seen children with tetanus, especially in neonates. In the process of our discussion, define tetanus, causative agent, incubation period, discuss the prognosis, points of entry and classification of tetanus. We will describe the pathophysiology of tetanus, identify the signs and symptoms, paying attention to the disease occurring in children and occasionally in adults. Together, we shall review the general principles of management of a patient with tetanus, explain the treatment with chemotherapy of an individual with tetanus infection, how to prevent its spread, and complications. Learning outcomes. At the end of this study, you should be able to 1. Discuss tetanus. 2. Describe the nursing management of tetanus. Tetanus. Tetanus is from a Greek word, ancient, tetanus, tout, and tenein, to stretch. It is a medical condition characterized by prolonged contraction of skeletal muscle fibers. The primary symptoms are caused by tetanospasmin, a neurotoxin produced by the gram-positive obligate anaerobic bacterium, Clostridium tetani. Infection generally occurs through wound contamination and often involves a cut or deep puncture wound. As the infection progresses, muscle spasms develop in the jaw, thus the name lockjaw, and elsewhere in the body. Infection can be prevented by proper immunization and post-exposure prophylaxis. Tetanus affects skeletal muscle, a type of striated muscle used in voluntary movement. The other type of striated muscle, cardiac or heart muscle, cannot be tetanized because of its intrinsic electrical properties. Definition of tetanus. Tetanus is an infectious disease caused by contamination of wound from bacteria that lives in the soil. The causative bacterium, Clostridium tetani, is an organism capable of living many years in the soil in a form called a spore. Medical Health Journal, 2010. Causative agent. Clostridium tetani. This is a gram-positive rod, an obligate anaerobe which forms terminal spores. To maintain a drumstick shape, the spores are highly resistant to drying and to high temperature, and they may withstand boiling for a short period. Incubation period. The incubation period of tetanus may be up to several months, but is usually about 4 days. In general, the further the injury site is from the nervous system, the longer the incubation period. The shorter the incubation period, the more severe the symptoms are. In neonatal tetanus, symptoms usually appear from 4 to 14 days after birth, averaging about 7 days. Reservoir of infection. Man, domestic animal, cultivated soil. Incidence. People with low personal hygiene. In the United States, because of widespread immunization and careful wound care, the total annual number of cases has averaged about 40 to 50 cases per year since 1995. In developing countries of Africa, Asia, and South America, tetanus is far more common. The annual worldwide incidence is between 500,000 to 1 million cases. The majority of new cases worldwide are in neonates in third world countries. Susceptibility. Agricultural workers, gardeners, farmers, home deliveries. Prognosis. Once contracted, Clostridium tetani is frequently fatal, with low morbidity and mortality in reported cases. Up to 30% of tetanus victims die. Early diagnosis and treatment improves the prognosis. Neonatal tetanus has a mortality rate of more than 90%. Mortality rates reported vary from plus 0% to 68%. In recent years, Approximately 11% of reported tetanus cases have been fatal. The highest mortality rates are in unvaccinated persons and persons over 60 years of age, 15 to 60% in untreated adults, 80 to 90% in neonates, even of treated. The prognosis is poorer if the incubation period is short and symptoms progress rapidly, or if toxin is delayed. The cause tends to be milder when there is no demonstrable focus of infection. The prognosis is poorer if the incubation period is short and symptoms progress rapidly, or if toxin is delayed. The cause tends to be milder when there is no demonstrable focus of infection. Mortality rate. Mortality rate 48 to 73%, 100% in newborn, averagely 50%. In recent years, approximately 11% of reported tetanus cases have been fatal. The highest mortality rates are in unvaccinated people and people over 60 years. The bacteria can get into the body through broken skin, usually through injuries from contaminated objects. Certain breaks in the skin that are more likely to get infected with tetanus bacteria. These include 1. Post-traumatic. 2. Deep penetrating wounds contaminated by contaminated with dirt, poop, feces, or spit, saliva. 3. Superficial wounds as in burns. 4. Umbilical cord as in baby neonatal tetanus. 5. Post-puerperal and post-abortal. This could arise by the use of contaminated materials, instruments, and dressing. 6. Post-surgical from the pressure of pathogens in the bowel or the use of contaminated instruments and dressing. 7. Other infection and cryogenics, e.g. chronic ulcer, guinea worm infestation, chronic otitis media, etc. 8. In some cases, no focus is found because of wound has been healed. 9. Crush injuries. 10. Injuries with dead tissue. Classification of tetanus. On the basis of clinical findings, 4 different forms of tetanus have been described: generalized tetanus, neonatal tetanus, local tetanus, cephalic tetanus. Generalized tetanus. Generalized tetanus is the most common type of tetanus, representing about 80% of cases. The generalized form usually presents with a descending pattern. The first sign is trismus, lockjaw, and facial spasms called risus sardonicus, followed by the neck, difficulty in swallowing, and rigidity of the pectoral and calf muscles. Other symptoms include elevated temperature, sweating, elevated blood pressure, and episodic rapid heart rate. Spasms may occur frequently and last for several minutes, with the body shaped into a characteristic form called opistotonus. Spasms continue for up to 4 weeks, and complete recovery may take months. Neonatal tetanus. Neonatal tetanus is a form of generalized tetanus that occurs in newborns, infants who have not acquired passive immunity because the mother has never been immunized against tetanus are at risk. It usually occurs through infection of the unhealed umbilical stump, particularly when the stump is cut with a non-sterile instrument. Neonatal tetanus is common in many developing countries and is responsible for about 14% of all neonatal deaths, but is very rare in developed countries. Local tetanus. Local tetanus is an uncommon form of the disease in which the patients have persistent contraction of muscles in the same anatomic area as the injury. The contractions may persist for many weeks before gradually subsiding. Local tetanus is generally milder. Only about 1% of cases are fatal, but it may precede the onset of generalized tetanus. Cephalic tetanus. Cephalic tetanus is a rare form of the disease, occasionally occurring with autogenic otitis media, tetanus, ear infections, in which Clostridium tetani is present in the flora of the middle ear or following injuries to the head. There is involvement of the cranial nerves, especially in the facial area. It is a common type in children. Pathophysiology. The bacillus gain entry into the body through a wound often considered insignificant and remains localized at the point of entry. Following invasion of Clostridium tetani, spores germinate and the spores multiply in anaerobic condition, which occurs in area of tissue necrosis, producing 3 different forms of exotoxin. Tetanospasm, a neurotoxin with a special affinity for nervous tissue, especially in spinal cord and cranial nerves, producing intense and several muscular spasms. Non-convulsive neurotoxin. Tetanolysin. These neurotoxins are absorbed by the peripheral nerves and carried to spinal cord, where they produce a reaction that amounts to a stimulation of the nervous tissue. The sensory nerve becomes sensitive to the slightest stimuli, and the hypersensitivity motor nerve carry impulses that produce spasms of the area that they supply. Signs and symptoms. 1. Irritability. 2. Headache. 3. Restlessness. 4. Low-grade fever. 5. Malaise. 6. Muscle rigidity. 7. Trismus. Painless spasm of muscle of mastication. 4 sets of muscles are affected, causing difficulty in opening of the mouth. 8. Rhesus sardonicus. Social laugh, brought about by the spasm of the facial muscles, frontalis muscles of angle of the jaw, producing a distorted smile. It is quite a characteristic for the disease and persists even during the convalescing. 9. Local spasm rarely occurs, that is, stiffness of spasm of muscles near the affected wound. 10. Opisthotonus. The head is retracted because extensor muscle are stronger than flexor muscle. 11. Feet are extended fully. 12. Back is ached. 13. Body is supported on the back and feet. 14. Severe spasm may lead to fracture of vertebrae. Investigations. The following are the diagnosis of tetanus. The diagnosis of tetanus is based on the clinical presentation of the symptoms. Care must be taken to distinguish tetanic spasms from convulsions. Laboratory identification of Clostridium tetani can only be demonstrated by production of tetanospasmin, potent toxin that affects the CNS, to produce the clinical manifestations of the disease in mice. Spatula test. It is a chemical test that involves touching the posterior pharyngeal wall with a sterile, soft-stripped instrument to observe effects. A positive test results in the involuntary contraction of the jaw. A negative test results in a normal gag reflex attempting to expel the foreign object. Arterial blood gases could be obtained frequently to evaluate respiratory status. General principles of management. 1. Prevent further toxin release by debriding the wound and giving an antibiotic. 2. Neutralize toxin outside the central nervous system with tetanus toxins, human tetanus immunoglobulin, and taking care to inject different body sites, and thus avoid neutralizing the antitoxin. 3. Minimize the effect of toxin already in the CNS. 4. Muscle relaxants form the main treatment. 5. Metronidazole is the antibiotic of choice. 6. Sedation and avoidance of unnecessary stimulation to control spasms and ANS dysfunction with use of benzodiazepines, diazepam, opioids, morphine, 1 mg or kg intravenously or orally or via nasogastric tube 2 to 6 hourly. 7. Anticonvulsants, phenobarbital up to 200 mg IV or PO or NG12 hourly. 8. Phenodiazines, chlorpromazine as an adjunct in relaxation sedation and controlling the ANS disturbance. Enteral feeding to prevent malnutrition caused by inability to swallow, metabolic rate, autonomic GI dysfunction, and muscular activity. 10. Nurse in semi-recumbent position to prevent ventilator-associated pneumonia. 11. Chest physiotherapy, mouth care, and regular tracheal sanctioning to prevent respiratory complications. Treatment with chemotherapy. Treatment is directed towards 1. Stopping toxin production. 2. Neutralizing its effects. 3. Controlling muscle spasms. 4. Prevention of further absorption of toxin from the wound by 5. Tetanus immunoglobulin (TIG) to neutralize the toxin. It may be infiltrated into the wound. 6. Therapeutic antitoxin ATS 20,000 IM VII wound debridement with H2O2 hydrogen peroxide. 8. Crystalline penicillin in high doses of 300 mg 500,000 units to eradicate persisting Clostridium tetani and stop production of new toxin, as well as eradicate other pathogens from wound. 9. Sedative and antispasmodic use, alternatively diazepam and chlorpromazine. Nursing management. The following are the gadgets needed: padded fracture bed, suctioning machine, oxygen, tracheotomy tube, drip stand, NG tube, bedpan. Different aspects of nursing involved here are neurological considerations, pulmonary considerations or wound management, administration of antitoxin, wound consideration, immobility considerations, psychosocial and metabolic and rehabilitation phase. Outcome criteria for patients with tetanus should include 1. Maintenance of the airway. 2. Prevention of the complications or respiratory dysfunction such as atelectasis. 3. Test of autonomous nervous system dysfunction such as cardiac arrhythmia. 4. Maintenance of proper gastrointestinal function. 5. Maintenance of skin integrity. 6. Compliance with the prescribed immunization schedule. 7. Extensive assessment should be done through the following mediums. K. Give and monitor the effect of prescribed drug, e.g. Legatil and Valium. L. Care of the wound with hydrogen peroxide. M. Check for signs of infection from the skin, urinary tract, respiratory tract. N. Open spasm chart. O. Record whether constant or spontaneous spasm. P. Rehabilitate with physiotherapy as condition improve. Prevention. The following are the prevention methods. 1. Treat every wound as potential tetanus wound. 2. Proper toileting of wound. 3. Passive immunization with prophylactic anti-tetanus serum, ATS, 1,500 IU. Adults, 750 IU. Children. 4. Active immunization with tetanus toxoid, 0.5 mls. The other is by active immunization of women of childbearing age with tetanus toxoid. Tetanus toxoid TT immunization scheduled for women. Tetanus toxoid TT immunization scheduled for women. See table. A. Intramuscular routine immunization for the pregnant women, full dose. B. DPT immunization for newborn, 0.5 ml from 6 to 14 weeks of life, 3 doses. Prophylactic penicillin as antibiotics. C. Health education on reaction of wound, especially farmers and agric workers, sterilization of instruments for circumcision, surgical operation and birth marks. D. Encourage hospital delivery. One involves ensuring strict cleanliness at childbirth in a sanitary environment and in particular by hygienic cutting of the umbilical stump after the birth. E. Treat all ulcer or local wound promptly. F. Use of clean material for menstruation. G. Avoid probing of the hair with any material. Complications. Malnutrition. Tetanus results in malnutrition because the child or individual infected may be unable to eat or drink. The inability to eat or drink is due to difficulty in opening the mouth, trismus. This leads to deficiencies of nutrients needed in the body, caused by sustained contraction of the jaw muscles. The baby cannot suck the mother's breast because of spasm in his jaw muscles. Sepsis. The body is infected due to the entrance of Clostridium tetani into the site of injury or umbilical cord of newborn babies, or if the cord is cut with a dirty instrument or covered with dirty dressings. Respiratory distress. The involvement of respiratory muscles and muscles of the larynx and pharynx causes respiratory distress and may lead to death. Asphyxia. Respiratory obstruction due to laryngeal spasm caused by a deficiency of oxygen O2 in the blood and an increase in CO2 in the blood and tissues as a result of poor exchange of gases that results from the spasm. Pneumonia. Inflammation of the lungs with consolidation and exudation. Atelectasis. In a collapsed or airless state of the lung. Respiratory obstruction due to laryngeal spasms. Apnoea and anoxia. Vertebral fracture due to ache of the back. Brain damage due to hypoxia. Circulatory failure due to overactivities of sympathetic nervous system. Summary of study session 15. In this study, we have defined tetanus as an infectious disease caused by contamination of wound from bacteria that lives in the soil. The causative bacterium, Clostridium tetani, is an organism capable of living many years in the soil in a form called a spore. Medical Health Journal, 2010. End of study session 15. Thanks for listening.